Hello and welcome back, folks. We're glad you're here. This is the Ridgeview Pod. My name is Michael Yates, and we try to cover everything hope, healing, and recovery related. It's always super cool when we can highlight a program of Ridgeview's. My guest today, Nichole Garrett, with the IPS, SE, all these acronyms that we throw around. Welcome, Nichole.
Thank you.
Glad you're here. Let's just start there. What is IPS and /SE? What does that stand for?
IPS stands for Individual Placement and Support. It's an evidence-based model of supported employment. That's the SE. And so it's a model that is proven to help people who have mental health disorders or co-occurring disorders get and maintain employment.
And our program is called Matched for Success, based on that model, correct?
Absolutely.
Yeah. So if folks go to our website and they're looking around, they may see Matched for Success, and that's this program.
Absolutely, yes.
One of the highlights, I wear lots of different hats here, as you know, but one of the things I love the most is being able to serve on like advisory committees. And you host, I guess, one of the evidence based protocols of the program is an advisory committee for Match for Success. And you guys meet in here in this space, and several of us come and attend and participate in that, as well as other state officials and staff members and even consumers of the service. And it's awesome because it's such good news always.
It is. One of the things that they tell us when, with IPS is that share success stories with everybody at your agency. Because one of the real key principles that we follow is zero exclusion, which means that we really view work as part of the recovery process instead of the outcome of recovery. And what does that mean? It just means that if someone identifies that they want to go to work, that's the greatest predictor of success of them actually going to work. And so, if somebody may have doubts about a person's ability or readiness to go to work, it's great for them to hear success stories. And I love sharing our success stories.
Yeah, well, and you do a great job of it. We've even been fortunate enough to have some of the recipients of that tell their story in a videotaped manner that we can share with staff at all staff. Pre-pandemic, of course, when we used to be able to do that. And I do think there's something very powerful about the contagious uh, impact of good news. So, with that good news, we were actually able to parlay the expanding the program with funding through the Appalachian Regional Commission, ARC. So, time becomes kind of a warp during the pandemic. It seems like we submitted this in, was it fall of 2019 or maybe winter of 2020? I can't remember.
I think it was winter of 2020.
Okay. And then we were awarded summer of 2020 that we got announcement of award.
I don't know, everything happened really quickly. I
Yeah.
think we got an announcement and then it went into effect in April, and we were expecting it to go into effect a little
Yes.
later.
Yes. Yes. So this was good news in that we were able to expand aspects of Match for Success specific to Scott and Campbell County through what's called the Ark Inspire program. But this had a different component to it. It was specific to helping those that were impacted by substance use disorder or opiate use disorder, right?
Absolutely. And so we've really been able to expand our services to people who have substance use disorders or co occurring disorders, co occurring with a mental health condition. And the one component that I really love about this is we've been able to add some supported education to our program, because really the point of the Ark Inspire grant is to improve the workforce in these Appalachian areas, um, and expand a qualified, trained workforce. And so our employment and education specialists are able to really partner with our folks, our clients, participants, um, as they figure out what they want to do. That may be finding a job to pay fines, to support
Mhm.
themselves, right at first, but then to explore different training programs, get a credential, a certificate, a diploma, something like that, that'll enable them to get a higher paying job over time. That's
Mhm.
one of the real exciting parts of that new grant.
Yeah. And look, I mean, correct me if I'm wrong, but this one also has a peer recovery component as well.
Absolutely. One of the things that I said I wanted from the beginning was to have a peer recovery specialist, somebody who has walked the walk, and is able to provide that hope of this is what it looks like, on the other side of recovery when recovery is going well and when work is going well. And so we have a peer on our team who is able to provide sort of that model of hope to our participants.
Yeah, that's outstanding. Well, I mean, is there, the challenge of finding employers that are willing to make this part of their own workforce development uh, must be difficult and challenging. I mean, do you have a message out there for prospective employers or for those that have stepped forward and said, you know what, I want to be part of this effort. I'm willing to give Sue or John or whomever an opportunity to come in and work.
Absolutely. The employers that we approach are really about, our message is really about giving people a second chance. And a lot of the employers that we work with are ready to give second chances to folks. Some statistics from supported employment in general is that folks stay longer at their jobs than the typical population. Their loyalty to the company is higher. And we can share success stories with them as well. We can hook them with employers who have hired our participants and are able to share their experiences with both our staff and our participants as they've, you know, given folks a second chance for employment.
hmm Now, if I'm watching this, listening to this, and I think either myself or I know someone who may benefit from a program like this, what would be the steps that they would need to take? If they're not a client of Ridgeview, do they need to first go through the same day access intake process?
The easiest and fastest way is to come for an intake through the same day access program and request the employment program with whatever other services are recommended and what they're interested in. They can also contact me directly. I think that information is on the website. It's
Yeah.
definitely on our brochure.
And we'll
Um,
put your contact information in the content of the broadcast.
okay, great.
Yeah.
What's really interesting is with the new grant, we have gotten direct referrals from the Scott Recovery Court,
Oh, wonderful.
and we've been able to connect some of those folks into treatment and into services that they may not have accessed before. And so there's really no wrong way to access our program.
Fantastic. Good. We like to say no wrong door around here, so that's nice to hear what that reach out to us and we'll figure out how to get you connected. So,
Absolutely.
yeah. So, I ask this of all the guests. I mean, it's strange times, it's hard times, complex, challenging times. The work is hard. So I'm always curious, how do folks how are you being a good steward of your own mental health and your own outlook for the future, knowing that the work is as hard as it is? Uh, what do you do to take care of yourself?
Well, So work-wise, to take care of ourselves, because I'm a team leader and I've got 6 staff that are part of my team, and we have team meetings every week. And since the pandemic, we've largely conducted them over Zoom. And we'll do team building, silly activities, get to know you kinds of things. Recently, we had a team building activity where we made tie-dye shirts for Suicide Prevention Awareness Month last month. And it really is, I think, hanging out with intent, um, supporting one another. We're spread in 5 different counties, and it really is supporting one another
Mhm.
as we face the challenges with finding folks employment and dealing with their challenges as they get back into the workforce.
Yeah, no, that's beautifully said. The previous guest was from United Way, and part of our conversation ended up uh, talking about how we are hardwired for connection and the importance of engagement. And when so much of the messaging is around physical distancing, social distancing, all the myriad of health protocols that are out there, trying to figure out how to still remain connected and engaged is really important. And it sounds like you're being a good steward of that with all those folks that make up both Match for Success and Ark Inspire. Well, if I had a good joke for you, I'd share it. But when you come back with a guest, I'll share a joke at that point. I would love to have you or someone who's been through the program maybe come back and talk about their experience.
That would be really
Yeah,
exciting. I'd love to do that.
yeah. All right. Well, see, this hasn't been that painful, has it? She'll tell me afterwards, yes, it was. Nichole, thank you so much for coming in.
Well, thank
I love the good news. I'm a a a oh no, the words escaping me, an evangelist of good news. So that's what I like to get out there, and this is certainly an important piece. And you taking time out to help our listeners and viewers understand what's going on with employment supports is really important.
well, thanks for the opportunity to share.
Absolutely. And thank you for taking time out of your day to tune in. We're glad you're here. If you haven't, please subscribe and ring the bell. That way you'll receive notification of each week's latest episode. And take good care of yourself. We'll see you next week.